Talk a little bit today about cancer prevention with Dr. Kishore here at Hematology and Oncology Associates of NEPA along Mead Street in Dunmore. Dr. Kishore, nice to have you on the show.
Nice to be here, Dave.
Well, tell us a little bit about the causes of cancer. We know that cancer's out there, but what are some of the causes of it?
So the cancer development, we exactly don't know what causes cancer, but there are definitely some of the reasons which increases the risk of developing cancer. Like we all know about tobacco smoking. So we know that smoking causes lung cancer, but what we don't know is it can cause many other cancers like oral, throat, colon, and the kidney cancers and the bladder cancer. Other factors like alcohol and radiation, like the nuclear fallout, can increase the risk of cancer. Some patients do have radiation as a treatment for some kind of cancers. So going down the line, they can develop secondary malignancies. So smoking, alcohol, radiation exposure. Some of the other things that you can do to prevent cancer is we now have vaccines for some of the cancers. We know that some of the viral diseases, viruses can cause cancer, like HPV. HPV is known to cause cervical cancer as well as some of the head and neck cancers. So there is a HPV vaccine. We cannot use them in older individuals because they're already exposed to HPV. But in younger population who have not been exposed to HPV, we should start using the HPV vaccination before they become sexually active, before they get the HPV infection.
I know here that at Hematology and Oncology Associates of Northeastern Pennsylvania, you also do cancer screening. Tell us a little bit about what that is.
What we do is recommendations. Cancer screening is something where you can detect cancer early. So if you detect cancer early, we can take care of, we can treat the cancer. It's much easier to treat. So even though, let's say that I'm seeing a patient for anemia, but it becomes relevant for me to tell the patients to go through age-appropriate screening. So even though I'm not seeing a patient for an oncology purpose, if I'm seeing a patient for something else like anemia, we definitely recommend screening protocols. And some of the screening protocols are like mammograms, colonoscopies, and Pap tests for females. And also one other thing that we don't usually recognize is endometrial cancer. The first sign of endometrial cancer is postmenopausal bleeding. So women should know that postmenopausal bleeding is not a normal thing, and if they see any postmenopausal bleeding, to bring it to their physician attention.
All right, a lot of good information, and those that need more information or would like to set up an appointment, Dr. Kishore, how can they do that?
Oh, they can always call us. We are always available. Our number is 342-3675.
All right, wonderful. Dr. Kishore from Hematology and Oncology Associates of Northeastern Pennsylvania here along Mead Street in Dunmore. Thanks so much. Pleasure having you on the show today.
Thank you so much, Dave.